Hi guys, Dr.Bupp here at Advanced Health and Wellness Center, and today I want to talk to you about arthritis and where arthritis comes from. How does it happen? Are you just stricken with arthritis? You know, you got the bad gene that causes it. Your family had arthritis, so that means you're going to have it. Those things are really not true. And also something that I want you to know that is true is that arthritis medications carry some of the most significant side effects and issues. And if you have a chance to look at those, look them up and actually see what kind of side effects are associated with prescription arthritis medications. So where does arthritis come from? It's inflammation, we know that. Inflammation of the joint, it's actually breakdown. So what happens, what causes the joint to break down? So the fact is, at some point in your life, you have different types of physical stress, and that could be slips, falls, car accidents, sports injuries. Sitting, believe it or not, in a certain position is a physical stressor. So just like a car that has bad alignment, the tires wear out faster than they're supposed to. If we have bad alignment in a joint because of one of these stressors, that joint is going to wear out faster than it should. I want to show you the phases or the stages here. So phase one means we lose normal position, whether that's a spine or a joint, we lose normal position. And when we lose normal position, it puts uneven stress on the joint. The losing of the normal position is actually a muscle, ligament, tendon problem. Phase two affects the cartilage. So the C stands for the cartilage. And that is really where we're seeing this arthritis kind of start to take shape. And that's kind of the early stage. So when the cartilage starts to decrease in size, that means it's losing water because of this bad positioning, and also bad biomechanics means it's not moving right. When the joint is moving properly, it pulls nutrients in, pushes waste out, keeps the thing healthy. This third phase, so if phase two doesn't get corrected, we move into phase three, which means the joint has the disc, the cartilage has degenerated, and now the body says, wait, this is still an unstable joint, and we got to do something to stabilize it, so it adds these bone spurs. So I don't know if you've ever seen an x-ray of yourself or you've seen x-rays, but decreased joint space and bone spurs, osteophytes, changes, roughness in the bone, those are all degenerative changes, and those are things where the body's saying, we need to add some stability here, so it adds calcium to the problem, or to the problem joint or problem area. The truth is, guys, there's a cause, there's a start of arthritis. It starts with something. It starts with inflammation and bad function of a joint. Our job, our specialty is to make that joint function better, function like it's supposed to. We can absolutely pull the emergency brake on the arthritis progression if we get function back. There's no medication that's going to do that. There's no, I don't know what other thing you might do with it. A hot pack, a cold pack. I mean, those things are not going to get function back to the joint, which is really the cause of the problem, and so we're trying to address that. So if you've been dealing with arthritis, or you know someone that has, you've been diagnosed with arthritis and you don't really know what that means or where to go from there, you don't want to be stuck with more medication on top of the medication that you already have. We know that these arthritis medications can cause vascular problems, other organ problems as well. So find out if this is something that can be helped naturally or with alternative medicine and rehab. We'd be happy to help you and to kind of take a look. So we do a consultation. It doesn't cost anything for you. It's free to sit down with one of our staff members or doctors to just discuss what might be going on and how we could possibly help. So that's the story on arthritis. Hopefully we'll see you soon. Don't deal with it, but get healthy.